Welcome, Lipstick and Logic. This is episode number 5, and we are tackling a very interesting topic today. Overfilled faces.
Yes.
Does it exist?
Yes. I think that they grace the covers of many magazines. I think it's unavoidable. And unfortunately, it's the bad work that goes noticed. It's the great work that goes unnoticed.
Okay, let's define overfilled faces. People who have too much filler, soft tissue fillers in their face, or it's not done well, or the faces just don't look natural and they had some sort of procedure done. Now, we're not talking about surgical procedures, we're talking about the non-surgical procedures.
But I think that that's actually, let's get clear on that. So you can get overfilled with fat. I've had patients that come in and tell me that somebody did a fat transfer and they got overfilled and it never went away. So it can get, and sometimes some of the work we see is from surgery, but they think that it's from a non-surgical procedure like filler.
Okay, but let's just focus on non-surgical for today. And fat could be non-surgical also.
Right, so it's just to get clear that all unnatural results are not just from non-surgical procedures, although that's what we'll cover today.
Yeah.
You can definitely have unnatural results from surgical procedures as well.
Okay, because in our conferences, we were hearing this all the time about people who have overfilled faces.
Yes, but hold on, let's just do a lipstick check real quick.
Okay.
Today we had a call with Sebastian Corofona, who is a famous anatomist and professor.
6 professorships.
6 professorships, but presently at Vanderbilt, and with Jocelyn Cohn, which is a oculoplastic surgeon that trained with Robert Goldberg at UCLA and is now practicing in Chile. And we really covered and dissected, literally and figuratively, this concept of the overfilled face.
And I think the reason why is because across the country, fillers have gone down. The popularity of fillers was so popular, it was growing at 10% a year. All of a sudden it dropped 20% in the last year or two. Why are people doing less fillers? And you see it all over social media. People are like afraid of fillers. You're hearing all these stories of overfilled faces. You see bizarre looking celebrities. Like, why should there be bizarre looking celebrities? I mean, if anyone can afford to get fillers, it's them, and anyone who has the resources to go to good people. But yes, there's many celebrities that are overdone and overfilled. Patients are scared and they're talking about it.
Right, and so it is possible with anything, right? Not everything can lead to a bad outcome, but sometimes it can.
But the majority of the time it does not lead to a bad outcome.
And a majority of the time it doesn't. And most good work, if it's really good work, it actually should go unnoticed. And you should just think and wonder, wow, that person really looks good for their age. How is that possible?
Because you can't tell when they've had it done.
Because you can't tell when good work has been done. And that's actually what defines good work. And so that's probably the reason why this is getting more negative press, because people that have great work sometimes don't necessarily advertise that they're doing anything because they want people to they want to keep people guessing. So that's the limitation.
So do you remember in 2017 I wrote a paper on this, predicting filler fatigue? I did. I know you read the paper.
And you're almost like predicting like the future.
Yes.
Like people should call your 1-800 number.
They should.
You're like Aunt Cleo. Eventually we're going to see you like at 2 a.m.
That's
running
right. I can read your future. You better be careful.
Here we go. Your second side job.
Yes. So I saw this coming.
Okay.
And the reason why I theorized it back there in 2017 was because I think we were training too many people inappropriately. And I know that's kind of a bold statement, but we were training people based on studies, because that's how many people train, and people weren't were taught to put too much filler into the face and not taught where to put it and why. Because when we talked to Sebastian today, the appearance with filler really is identified how good or bad they look based on when they animate. Right? Someone can look good with a static face, just in a photo. And their face is all filled in, no wrinkles and lines. That's how in the studies. But in real life, we animate, we talk, and if there's something off in the animation, we pick up on it. We're so good. Humans can discern an unnatural ability to animate appropriately, and we pick up on that.
And so let's keep it real then. So how can people literally keep it real or keep their faces looking real with fillers? Is it possible?
Yes. But you got to use a little bit in the right places.
And so this is really important because in the trials, just because, for those that don't know us, we participate in a lot of clinical trials. In order to get approved, a product approved, these trials can only last so long. We can't follow people for 15 or 20 years, right? So that's one limitation sometimes of trials. And the second is that there has to be an endpoint, at least one that is objectively captured, right? So scales are developed, but the limitation with the scales, and we participate in them, in creating them, is that they're with people at rest, without moving, which is what you just highlighted so well. And so what happens there is that at rest, their nasolabial fold might improve 2 points, and that's what regulatory bodies would like to see in order to be able to deem the product actually efficacious.
So we have to put enough in to make a change so you can pick up on a photograph.
So that we can actually say that, yes, this product is efficacious. The limitation is that most people don't sit stoically, well, maybe you, without any animation. Most of us are smiling, laughing, frowning. And so in those movements of facial expression is where you might capture that unnaturalness or a limitation or impediment in that movement that signals to your brain that perhaps something has been done to the face.
And the easiest thing to pick up on that looks unnatural is a smile. We're so good as humans at picking up someone else's smile, and that gives us a lot of information about that person. So if a smile is fake, which is called a non-Duchenne smile, but a fake smile, you can pick up on it. And when you have too much filler in the face, or if it's too superficial, or the crow's feet aren't animating, then you will think that person is fake and phony. And the reality is, you as an individual, if you have too much filler in your face and you can't smile fully, you actually feel sad.
So talk to us, because you highlighted something that was really interesting about blood flow to the brain and as a potential reason why.
So I've published on this in the past, and it's really interesting, and it's really coming more current today with the overfilled syndrome. So when you smile, you actually put compression on one of your facial veins that returns blood flow to your cavernous sinus, which is the center part of your brain. That cavernous sinus then provides an increased temperature or decreased temperature to the amygdala or some of the most primitive parts of your limbic system or your brain that controls emotions. So one of the feelings is, why a smile? When you smile, you become happier. It's not the opposite. You don't become happier then you smile. You smile first, then you become happier because you control the blood flow to the brain, which then tells your brain, okay, you're happy, you're smiling, and you're happy. So an expression precedes an emotion. It's complete opposite of what people think. So if you put too much filler in the face and you can't smile completely, it can impede the blood flow to the face, which can change the temperature in the center part of your brain, which can then influence your amygdala and your limbic system. So it's really interesting that can happen because you get too much blood flow, then it's hotter in your cavernous sinus, your temperature goes up, and you're not as happy. So the reality is your smile influences the blood flow back to your brain, which then influences your emotions. And when you have too much filler in your face, it can influence that. Isn't it crazy that expressions, emotions, they're all intertwined and interconnected, yet we don't really pay attention to it. Because I want to fill my face, I'll make it look smoother, less wrinkles. But you're affecting your expressions and your emotions, and we don't take that into account when we inject faces. Or most people don't. They don't know that.
Well, they just don't know it. I mean, that's the reason why we're having this conversation, right? Because these are things that can't necessarily also be included in the 20 other secondary metrics that are being included in a clinical trial. And so it doesn't mean that it doesn't exist or that it's not happening. It's just that it can't be necessarily measured, or not everything is measured during a trial.
Well, I think it can be measured to some extent with patient-reported outcomes and observer-reported outcomes, which you and I are both publishing on. Yes. So if you have filler in your face and I look at you, I can tell if you're natural very easily. How do I do that? It's not just when it's, obviously we can all detect when someone has too much filler and it's overt and it's like ridiculous, they look like a pumpkin face, right? And that was bad injection. But even if people have just a little bit too much in the wrong places, like too much in the medial cheek, they have the transverse septum, which we've talked about here, which you can see that, if you can see that line across their face, they've had too much filler superficial. Those are subtle clues that the other person picks up on subconsciously. They don't consciously know you've had too much filler, but they know something's off with your face, and they can't describe it or define it.
So it's not the filler's bad. It's just that the wrong amount and perhaps the wrong kind in the wrong place can lead to unnatural looking outcomes, which is why it's important to choose an injector perhaps that's not celebrating these transformative results, but perhaps celebrating the long-term results of somebody that's touched by their hand, so that you can see if over time this person is showing some level of constraint and not overfilling that face.
So it's a great summary that you brought up. Yes, so how you inject it, where you inject it is critically important, and that's not being taught to the masses. Second of all, you brought up something earlier today, which I think we should touch on, and that's that this is a medical procedure.
Correct.
And there's certain conditions that put you at higher risk for an adverse outcome or a bad outcome with fillers. Why don't you talk
Right.
about
And so, and then before I go into that, which is also these fillers get indicated for, we saw results for a year. We saw results for 2 years because that's how long the trial lasted.
Right.
But that doesn't mean that you will not show results for much longer than that time. It's just that the companies can't claim that it lasts for any longer than how long the subjects were followed in a clinical trial. And so if you actually look at the endpoints of these trials, sometimes 64% still show some level of improvement at the end of the trial. So that means that there's still product there. So no, you don't need to get your lips injected every single year because it only lasted a year, or the trial only lasted a year.
Because patients always ask, how long does it last? And it's like, well, the clinical study went up to 1 year or 2 years, but you can get results beyond that.
Right, and you still may have some product there. It's just that you may not have enough product to give you the same clinical effect that you enjoyed 2 weeks after your injection. So how long something lasts, we have to be careful how we define that sometimes, and I try to get clear with my patients. How long the clinical effect may be that you enjoy, maybe a year and a half. How long does the product live there? Probably a lot longer. And so that's really important to like highlight. And that's the reason why you may not need as much product in a subsequent treatment, because you're adding to what already may live there. But back to your point on these products being medical procedures, right? History, that history alone. Have you had stuff injected there before? Because now you know that you're entering a canvas that has been manipulated. And so if you introduce something else, you may not need as much. So these are medical procedures that require a medical history.
What about autoimmune disorders? If you had a previous autoimmune disorder?
Right. Do you have, a particular autoimmune condition like lupus or one of the other, dermatomyositis or other conditions that can affect the skin or can be hyperinflammatory in the skin?
Or thyroiditis too, which has been a problem for some people with fillers?
Especially if you're injecting near or around the globe, or eye or orbit, which is why I'm a big proponent sometimes of tightening that tissue first, actually, with laser resurfacing. So then I guess my second biggest one is I think all problems were being addressed with fillers before. And it's not that the hammer doesn't work, it's just that sometimes you need a screwdriver. So in this case, sometimes the stuff around the eyes, it's not that the filler doesn't work, it's just that you probably needed a different type of procedure, like something to thicken the skin of the eye, or a laser to help with the hyperpigmentation that's causing the darkness, not the filler.
So back to the medical, you're right, medical procedures, it's a medical procedure. You have to treat it like a medical procedure, which means a thorough history.
And an assessment. Like this is like ultimately a medical procedure, right? So someone needs to assess you. You don't go get a total knee replacement without an x-ray. Like somebody has to assess the knee before they go operate on the knee. The same would be the case, I think, when it comes to a medical aesthetic procedure.
Right.
You need someone who understands there's an art to the assessment. If not just what's the deficit or what's the issue, but if I treat the issue, what will it affect? What will it impact? It might make another area look worse. It might perhaps highlight another deficit. I don't know. So you have to have that understanding.
No, I totally agree. And there's different types of fillers, and they all have different properties. And I think we should talk about that also. And you use them differently in different parts of the face.
Right. So not all filler is bad. It's just that if you're using the wrong filler for the wrong indication, of course it's going to turn out bad, right? And so it's also going to someone who has that understanding or that has the ability to use all kinds of fillers in their armamentarium so that they can treat you with the right product for the right indication.
You really have to see someone who understands the anatomy, who's been done many of this. Ask about their experience. Ask have they seen complications. Ask how they treat those complications. What do they do to prevent any bad outcomes? Because I really think that fillers are a great tool, like any medical thing, any medical procedure we do, any prescription, when I give you a medicine or do a surgical procedure,
right.
They all could be great or they all could have bad outcomes. The bad outcomes are incredibly, exceedingly rare, right? Like you don't get onto a plane unless you know your pilot's is trained. You don't go with the scuba diving instructor unless you know they're trained well and they're going to be good. Your doctor or your provider as well has got to be well trained and ask them a lot of questions and don't just be flippant about it. It's a medical procedure.
Right. So this is not like choosing your flowers for your wedding on Instagram. Like it should be like, a thoughtful consideration like you would for any medical procedure that you undergo. And making sure that that person has the credentials, like the credentials that you would want for your mother if that person was going to undergo a spine surgery. I feel like that level of thought should actually be used.
And then you can expect to get great results. I mean, vast majority of people, I've treated tens of thousands of people with fillers, and I mean, the happiness level is so high and the satisfaction rate is so high with this.
Well, there was actually a study that was done that you were involved in, I believe, which was the Harmony trial, where they actually looked at the impact that these aesthetic procedures could have on the quality of life of an individual. And in fact, after a hip replacement, which has like over a 90% improvement in quality of life because people can all of a sudden get out of the chair and walk around without pain, fillers came in second.
Yeah, fillers ranked up there with some of the most highest quality rated procedures that we do in medicine.
So it's something to consider that these procedures, I know that in my practice, they really improve, not just the way that people look, but also that the way that they function, they feel, because when you feel better, you just function in the world better. And people feel and report that they can, when they look not as tired as they feel, because they're sleep deprived from being a mom, or they're sleep deprived from being a mom and a CEO, they just do better. And so there's definitely a positive impact that these procedures can have on people.
And when we talk about fillers, we're mostly talking about the hyaluronics right now, but there's one that you're it's considered a soft tissue filler before, but now we're really calling it a biostimulator. That really seems to be, I mean, that's growing, that's even gaining popularity right now, especially with the GLP patients who are requesting treatments for the face, are the PLLA products like Sculptra.
Right, and so there's things like Sculptra, which in a clinical trial that we did, we actually saw that the stimulation goes well beyond just a fibroblast, but potentially even the stem cells that reside in our tissue. And so there's definitely an impact that these products are having in even the longevity of our skin. And so now more than ever, with people with such an awareness of health span and overall longevity, there's definitely a role that you want to feel great, but you also want your face to match your youthful 80-year-old body. Otherwise, there's a discrepancy there. And so biohacking is not just reserved for every organ other than the skin. The skin can also be biohacked, and there's no doubt that these lasers and injectables can do it. And we're doing a lot of the cutting edge research to actually prove that right now.
All right, so let's get to our doctor's notes.
All right.
So what I would say, if I was going to give a doctor note on filler fatigue, I think filler fatigue is just a trend right now that people are talking about. That's clickbait. I think that as the patients with GLP come in, and we're seeing a lot more of them now that need some sort of treatment for the face, we're going to see a resurgence of fillers. But I think we're going to have more emphasis placed on making sure you go to someone who is well trained, who really understands the anatomy, who knows what they're doing, knows how to take care of complications if one were to occur, or if there were a bad outcome were to occur, they could fix it. And I think you're going to want to make sure you really see some of this experienced.
Remember that a lot of great work is the work that goes unnoticed, and you generally only really notice the bad work because it's pretty obvious. And so that's one of the unfortunate things of this of this field, is that only the bad work gets noticed. And so most people that are looking really good for their 50s, 60s, 70s, I mean, even in their 40s, are most likely undergoing something. And so just be aware of that. It's not always just olive oil.
Yeah, less is more, I think, here.
As with a lot of things in life, I completely agree with you.
Well, I can think of something that's more and more. Pizza.
Well, Matteo would agree.
Yeah.
And I'd say probably my last note is that the future of biohacking also involves the skin, because you can have excellent joints, your heart can feel great, your mind can be sharp, but if you don't look good to match that 80-year-old body, then you're going to be disappointed, and you may have missed your window in being able to really regenerate that skin. And so there are a lot of there's a lot of promise in the topicals, in the lasers, and in the injectables that we do to actually show that there's an improvement in cellular senescence, stem cell exhaustion, and intercellular communication, all things that we know participate in aging. And so I wouldn't go with this, this trend that we're seeing now, because there's a lot of power in these procedures.
Agree.
All right.
All right, we'll see you for the next episode.
Bye.